Kidney disease associated with diabetes is the commonest form of kidney disease found in the UK and indeed worldwide. And around 40% of people with diabetes will get some form of kidney disease in their lifetime. And as they get older and they survive longer, we will see that percentage increase. What can they do to prevent this? Well, there are things that they can do. Initially, and most particularly in the first 10 years after diagnosis, good control of the diabetes will reduce the chance of an individual suffering kidney disease later in their lifetime. Once you have kidney disease, good diabetes control is still important, but the things that are most important are the management of blood pressure and then getting started on treatments to help slow deterioration in kidney function once the kidney has started to be damaged. So the secret is that every person with diabetes needs to have their kidney health monitored once a year. And what needs to be done is very simple. A blood test to test kidney function, a urine test to look for protein, and a blood pressure assessment. And then intervention can be started at the earliest point at which kidney problems develop in diabetes. Lifestyle is really important, both in the management of diabetes and in the management of kidney disease associated with diabetes. Good lifestyle interventions, including a good healthy diet, trying to reduce the amount of highly processed foods, trying to concentrate on getting weight reduction, are all really important, as are interventions to try and reduce your cardiovascular risk. So looking at your cholesterol, smoking, and again, weight. But perhaps the most important lifestyle intervention that we have begun to appreciate, tops them all, is activity and exercise. Huge improvements can be made both in quality of life and in progression of chronic kidney disease or any complication of diabetes by increased activity and exercise. So people who come to see me are given practical advice, not aspirational advice, in relation to lifestyle, and that includes advice on activity and exercise. Over the last 10 years, there has been a fantastic development in relation to medicines that we can use to treat kidney disease in association with diabetes. Before that time, we had one group of drugs that was called the ACE inhibitors or the angiotensin II blockers, medicines that ended in either pril or sartan. These drugs were drugs that reduced blood pressure, but also prevented progression of diabetic kidney disease. We had nothing else other than good blood pressure control and lifestyle. However, over the last 10 years, we now have a series of new medications. We have a group of drugs called the flozins, they end in flozin, that were originally developed to treat diabetes, but which we now know have a fantastic effect at reducing progression of both cardiac and kidney complications of diabetes. And everyone with diabetes and any form of kidney disease should be on these medications. I should highlight, though, that is only at this stage for people with type 2 diabetes and not for people with type 1 diabetes. And as we were launching this new group of drugs, we then had a new medicine called finerenone, which is a very novel drug that we now know will additionally prevent deterioration in kidney function with people with diabetes. And added on to the original group, the ACE inhibitors or angiotensin II blockers and the flozins, has a further beneficial effect. And as if that wasn't enough, we now know that the injectable drugs that we use to treat obesity and also diabetes, people may have heard of Ozempic or Mounjaro, also have significant benefits in relation to slowing kidney disease and also reducing cardiovascular harm. So we have a range of treatments that we can offer you. And if we can use those treatments appropriately, many people, particularly those with early or moderate diabetic kidney disease, can be stabilized and avoid the need to consider dialysis or transplantation in their lifetime. It is really important that any person with diabetes, whether it's type 1 diabetes or type 2 diabetes, has their kidney health monitored. And it's really simple. This is recommended once a year. It is a blood test for kidney function, a urine test to look for protein or damage to the kidneys, and a blood pressure assessment. We call that a kidney health check. And you should be receiving this if you have diabetes from your NHS GP. It's really simple, and it will pick up the earliest features of diabetic kidney disease, allowing really early intervention and prevention of harm. Unfortunately, there are no signs or symptoms that you get in diabetic kidney disease, essentially until the kidneys have completely failed. You may notice some ankle swelling, but by then you've already got fairly advanced kidney disease. And that's why I tell patients, signs and symptoms don't help you. It is the reason why everyone needs to be monitored for their kidney health if they have diabetes. And if we do that, we can identify people early on in the course of diabetic kidney disease, and we can really make a difference to people's lives.